It's great to be with you today. I've been asked to cover how COVID has impacted people across Hawaii from our perspective, including for providers across the state. My COVID presentations have certainly changed a lot since the pandemic hit. We started off talking about fear and anxiety because everything was going to kill us. The bananas in the grocery store were going to kill us, and the mail and that sort of thing. And as we figured out things along the way and adapted to COVID life, a lot has changed. I'm now talking about the impact in terms of what I call the emotional erosion that has hit many of us due to this pandemic. I'm going to discuss how COVID has impacted our stress, burnout, resiliency, compassion fatigue, 6 basic factors that I think undercut our lives these days. Then I'm going to get to what we can do about it for ourselves and for those we treat. It's a lot to cover in 30 minutes, so I'm going to go pretty fast. So here we go. If the technology works, and it does, I'm going to get my face out of here so you can look at the important stuff. Nope, that's not it. Let's look at the presentation rather than Dave. Okay. My wife, Dr. Valley Hawkins Mitchell, and I are the owners of Employee Assistance of the Pacific, Hawaii's largest EAP, as Summer said. I've had decades of experience on the mainland as a licensed mental health counselor and disaster mental health expert before we moved to Hawaii 15 years ago. I ran 2 other EAPs before we acquired Employee Assistance of the Pacific. Now we take care of over 250 employers and their employees across the state. So I stay pretty busy taking care of a lot of people that have been impacted by COVID in a lot of different ways. The disclaimer here, the financial disclaimer, is that I do own EAP, and there are companies, including Queens and Kaiser and Hawaii Residency and Clinical Labs. A bunch of clients pay for my services, but they don't get to control what I say, but that's the financial disclosure. To start off, I'm going to share one of my backstories that goes back 20 years ago. We lived on the Yakima River in rural eastern Washington state, and I noticed that a tree on our riverbank that had an occasional bald eagle staying in it was getting undercut by the river. We reached out to see what we could do about it and spent years working with 7 branches of government, finally obtained a conservation grant to stabilize our part of the riverbank. We had bulldozers and boulders in our backyard. It was just an amazing transformational process. And finally, we were part of an incredibly complicated riverbank stabilization project that helped our land not be washed away downriver. Here's our property. We had a lovely outdoor sculpture art gallery alongside our counseling practice on the river with monumental art. And this bald eagle liked to hang out there as well. As the Yakima River came up in the winter and dropped down in summer, we'd lose about a foot of property at our bend of the river every year. And it was threatening the tree. So we called and said, what can we do about it? And it started a project to save the riverbank. We had bulldozers dropping boulders in our backyard to bend the river and slope the land so the water didn't uncut the river bank. Then they added jute fabric and plantings and grass seed and more rocks, and voila, we had a stable riverbank. Yay. Here's the model I came up with. It all started when we became aware of the erosion going on. Then we aligned resources over the next couple of years, developed a plan, and finally took action to increase the stabilization of our property. Do you think that helped? Well, it was too late to save the tree we tried to save. That was the first thing they took down. But the bald eagles found another tree and the riverbank was stabilized. But then we moved to Hawaii, so who really cares? So I applied this model to what I see going on in today's Hawaii workplaces. I see a lot of emotional erosion going on around the state. I see 6 primary factors contributing to this emotional erosion: pandemic fatigue, stress, burnout, compassion fatigue, the state of today's workplaces, and the mental health and family challenges we're all seeing because of COVID. I'm going to review each of these 6 factors, then get into what I hope can lead to greater emotional stabilization for all, highlighting 4 approaches: attitude, resiliency, self-care, and mental fitness. My hope is that you find one tip or tool or suggestion in this section that might help you take action to stabilize either your emotional erosion or support someone else's. I'm going to start with the first major contributor to emotional erosion, pandemic fatigue. Our lives have changed, our work has changed, our families, our travel, our mental health. We're tired of it, we're cranky, we just want it to be over. Not only are we dealing with the challenges of our patients and clients or customers or coworkers, many of us are dealing with our own personal challenges due to this pandemic. Fear and worry, COVID, brain fog, challenges with the remote work or school, finances, dealing with the impacts of our keiki, our teens, our college students, our kapuna, our grandchildren, grief over those we lost, financial challenges again, distance from Ohana or friends on the mainland, or even being able to have lunch with a friend without masks or catching COVID. It leaves more people feeling disconnected than ever. And it's not just you, it's all of us. As a disaster mental health expert, I'm used to helping people through a fairly predictable track of a disaster. There's the beginning, the middle, and an end. Hurricanes, tornadoes, earthquakes, tsunamis, they all have a beginning, a middle, and an end. Even when I responded to the World Trade Center attack, there was a beginning, a middle, and an end of that disaster. With COVID, we're still not at the end. I hope maybe we're in the late middle stage, or maybe the early final stage. I don't know, but nobody knows. We're still struggling with whether we should go out without a mask. I was the only one this morning on a bus with a mask on, without wanting to be paranoid, but wanting to be safe. And even in the healthcare field, for a while, they were talking about us going into the tridemic, COVID, the flu, the RSV. That could have been even more fun for all of us. So it's a lot going on. And my guess is you've seen some of the symptoms and challenges of the pandemic fatigue in your own world. You could probably add more symptoms to this list, but most of us are dealing with more than we did pre-COVID. In healthcare, you know about trauma-informed care. I always remind people this certainly applies to COVID. Those of us who are trauma or abuse survivors may have experienced this pandemic differently. If you're currently ill or have a history of illness or an autoimmune disorder or going through chemo, you're going to experience these times differently. If you're a veteran, this may hit you differently. If you're an addict or a recovering addict, this may impact you differently. If you've had a recent loss of a loved one, as so many of us have these past few years, it may hit you differently. And then add the Ukraine war to this, or school shootings, or the lovely political divide we're in, and it just starts impacting more and more of us sideways. So keep in mind that pandemic fatigue is here, it's real, and it's still impacting people and causing emotional erosion. One last thing that's important about pandemic fatigue is at the beginning of this pandemic, all we focused on was the bottom two parts of Maslow's hierarchy of needs, our safety and physiological needs, especially in the healthcare field. At the early half of the pandemic, it was all hands on deck and 12-hour shifts, and you felt guilty if you took a 10-minute break during your 12-hour day, or a 10-minute break was just impossible for weeks and weeks and months. And every industry had to adapt, react, find new ways to be more safe. It's important to focus on safety during a global pandemic, but now we start to factor in and focus on those other parts of what makes us fulfilled and whole and able to survive our work challenges. In your work, you probably never experienced this thing called stress, so I'm going to go over this pretty quickly. There's good stress and bad stress. You get a promotion, that's good stress. You run a marathon, your kid gets an elite in school play, or going to prom, or graduating, or having a baby, that's good stress. They're positive, but can still create stress. And we all know what bad stress is, those 1s to 10s that stress us out. During the pandemic, a lot of people who were doing pretty well have kind of slipped down a bit. Those in the middle have slipped down a bit, and those who are at the bottom, highest in negative stress, have slipped as well. We are certainly seeing more mental health challenges, drug and alcohol abuse, domestic violence, and child abuse. We're seeing more suicidality at home, at school, at work. Too much stress manifests itself differently in all of us. Take a look at this list and see which apply to you and when what happens when you get too stressed? How about your spouse or partner, your kids, your coworkers, your patients? We're all over the map in how we react to stress. I encourage people to take a look at your first initial symptom to see, so you can take a look at your stress level. Myself, I get a cold sore. My lip says, okay, too much is going on. It's time to decrease your stress. And knowing this has helped me address my stress earlier before my body tells me my stress level's too high. This January, my mom passed, and after not traveling for 2 whole years, I made it through 3 mainland trips, a week seeing her before she passed, a week just after she passed, and a week for the funeral service, and catching COVID on one of those trips before my lip finally said, okay, that's enough, and exploded. And it exploded this week too, thanks to home renovations and office moving coming up. Yay, what fun. My lip tells me when I'm too stressed. But keep in mind that a lot of people are good at masking their stress. So you might not know whether someone's stressed unless you know them pretty well. Stress impacts us at work, and work can add to our stress. Job stress costs US industry over $300 billion annually. So the more we can do about it, the better. And the more you can help your stress team, the better you will be. Encouraging them to seek help for stress may prevent them from an accident or a healthcare crisis or leaving their job. If you see a team member stressing out and you care about their well-being, or you know if they don't take care of themselves and leave their job, that would impact you. If they have EAP benefits, remind them that the EAP benefit is available to them, or point them towards some helpful resources. So that's stress. And again, probably not a new concept for any of you.
Hi, David. Sorry
Yes.
to interrupt. Is it okay if I go ahead and share the slide deck you sent me? Because some people are saying that it's hard to read. It's a little small.
It's a little small.
Are you
Okay.
able to put it full screen?
I think that's as full screen as you get. If
It's
you
I can share it. Just the one you sent me, it has double slides if that's okay with you. Like you'll see two.
that's about only half the slides though.
Oh, I see. Okay.
Trying to think.
I think we can
What
just the small, the ones with a lot of words are kind of small.
Yeah, the ones with the smaller words, if you can't read it now, I've shared this in a PDF with Summer, so she'll be able to share this. It's also available on the website, I see, so you can download it and look at it that way.
Yeah, okay. I'll go ahead and put the website in there if you guys want to kind of follow along.
Sorry about that.
No, thank you.
Sometimes technology works, but yeah, if you're doing this from an iPhone, you may not see the fine print very well.
Yeah, okay, thank you.
You bet. Thanks for letting us know. Okay, the third factor leading to emotional erosion, and the most common complaint these days, again, probably not a new one for you, is burnout. Burnout is a stage of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. You feel overwhelmed, emotionally drained, unable to meet demands. Burnout can be work-related, home-related, or both. There are physical symptoms of burnout that develop. You feel exhausted. You can't recover well from what you usually recover well from. It just starts impacting your body. It starts impacting your behavior. People get cranky, irritable, cynical. They may start drinking or using more. Over time, it gets harder and harder to be around someone who's burned out, and it's harder for them to be around you. Here are some of the scary statistics. 48% of US workers say they feel burnout sometimes, and this was before the pandemic. 21% say they feel burned out always. That's 1 in 5 of us. And it's worse in healthcare. I'll share that with you too. If you're experiencing burnout, you're more likely to call in sick, visit the ER, you're less confident of your job performance, you're 3 times more likely to leave your job. And that, again, that was before COVID. Since COVID, Gallup found that individuals in general have the same level of burnout, but people managers went from 28% to 35% feeling burnout very often or always. And project managers went up as well. Managing people or projects during COVID leads to more feelings of burnout. Burnout has clearly increased for physicians. The AMA came out a month ago saying that 63% of US physicians are reporting signs of burnout at least once a week. Mayo Clinic published a study saying how much this has changed since the pandemic. Emotional exhaustion scores rose 39% higher. Burnout increased around 25%. But what was interesting was that depression didn't rise the same way, which suggests that the distress physicians are feeling was primarily due to increased work-related stress, not personal stress, but work-related stress. Again, not a big surprise, but the science tends to document or back that up as well. The AMA came out even further backing this up, saying while burnout manifests in individuals, it originates in systems. Burnout is not the result of a deficiency in resiliency among physicians. Rather, it's due to the systems in which physicians work. So as I start sharing tips for resiliency and tips for dealing with stress, I just want to acknowledge that it's not necessarily that you're failing as a human being and that's why you're burning out or stressed. These things in work are real. You can't fix all the reasons for burnout with a deep breathing technique or a yoga pose. They might help, but it won't fix everything. But if you or your crew are burning out, there are some things you can do to lessen the challenges. And I also want to keep in mind that it's not just healthcare. I'm seeing the same thing, or it's not just your company too in healthcare. I'm seeing the same thing across the entire healthcare industry. And I'm seeing it across the hotel industry, the construction industry, in education, in finance. Just about every industry I work with in the 250 companies we cover are complaining about burnout. The common themes are, we used to have 10 people do this task and now we have 8. We can't find workers to fill open spots. People are quitting faster than we can hire them. People are retiring early. People would rather work from home than come into work. I know many of the challenges you feel are unique and have impacted you, but keep in mind the same is true for hotels who had to lay off all their workers and are now trying to hire them back because tourists are back and people are scheduling more events than ever. Or transportation companies where they can't find drivers to drive their big rigs in the midst of a supply chain crisis. It's not a contest to see which industry has it worse, but it may help knowing you're not alone. And knowing this might help you remind your team and your coworkers that they're not the only ones impacted by burnout these days. I'm going to quickly go over the 5 stages of burnout, as well as what to do in each stage. In the behavioral health field, I'm going to turn my camera back on here if I can. In the behavioral health field, we have what's called a Jellinek curve, and it's a curve that goes up, down, and then back up again. That's when an addiction is going on, things get predictably worse until you get into treatment or sober up or whatever, and then things start getting better. That's the Jellinek curve. Burnout is kind of the same way. Get back to the presentation, not me, yay. You don't have to bottom out to get as an addict to get some help, but the sooner you do it, the better. Same thing is true with burnout. You don't have to bottom out before things get better, but the sooner you catch it and do something about it, the less carnage you leave around you and the less carnage you do to your body. I'm going to these are in your handout, so if you want to know the details about these, the better, but it starts off with the honeymoon phase is the first, where you're given 100 and 200% and everybody loves it. If somebody's given 200% that works for you, that feels great for a while, but it doesn't last and they're going to burn out. So it's okay to set limits and let people know you don't expect more than 100%. Second phase is the onset of stress. The job isn't as fun as it once was. You're now trying to balance everything thrust at you or balance having a life. Your energy starts decreasing. You start feeling dissatisfied. This is the time to pay attention to your rising stress levels before symptoms start to develop. Mindfulness techniques help. You can watch YouTube videos on mindfulness techniques if you want to, or talk to your EAP counselor about that. If you're a supervisor, Provide your stressed employees with regular one-on-ones, team huddles, pulse surveys, just listen to them empathically if you can. Remind them of the importance of self-care and taking care of business. As a supervisor, if you have an employee who needs to take a mental health day, support them as best you can and model how important self-care is. If you're working 90 hours a week, you're not going to be able to model how important self-care is. So do the best you can at modeling self-care, no matter how hard you work, and boundaries as well. The third stage of burnout is when it starts impacting your body. You start getting symptoms, your energy is gone, you snap more, you're detached from caring about things. This is when it really becomes time to do something about it. And if you're supervising somebody whose burnout is impacting their health, it may be time to get them some help. Stage 4 is true burnout. You're heading for trouble if you're here. Now's the time to really take a look and ask whether this is the right job for you or the right career, or maybe you don't have any good boundaries, or you're a severe people pleaser, or you're trying to be superhuman. It's time to take a look at how you show up for work, whether you're leading with your strengths, whether you can delegate, whether you actually like your job. You don't want to have that go into the next stage, which is habitual burnout. You're just enmeshed with your own burnout, and you may not even recognize your burnout because the symptoms are so embedded. This is the time where people even get suicidal. So if you hear a suicidal comment, don't ignore that. You don't want to overreact or underreact to that, but it helps to have somebody, your HR person or your EAP or a peer in your field that can talk to you about what to do if you hear a suicidal comment. So that's burnout. The next one, shifting to compassion fatigue. We saw a lot of this the first year or two of the pandemic in the health field, especially. People called up saying, this isn't the kind of work I signed up for, or I feel like I'm working in an army hospital in a combat zone. Hospital workers were used to fixing people up and getting them out, not watching them struggle and die. The emotional toll from not having family members present or dealing with family members over the phone or in the parking lot was just a lot to handle. The definition of compassion fatigue was from the healthcare field, the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick or traumatized people over time. It's resulting from taking on the emotional burden of a patient's agony. It's just a lot to take in, and when you add things like Ukraine and school shootings and 6.6 million deaths worldwide, we just can't take it all in, and we have to start turning off the news, stop donating, stop beating our pots and pans for healthcare workers. There's only so much we can do. It's not the same as burnout, but it feels the same. Okay, next one is today's workplace. Here's some scary statistics about today's workplace and how they impact emotional erosion. Again, not just your organization, national numbers. 48% of Americans in the workforce are looking for a new job. That's pretty scary. More people are quitting, either quiet quitting or loudly quitting. The Great Resignation has happened. People are more disengaged with their jobs. People are having a hard time balancing their work and their personal commitments. We're working harder than ever because we don't have the same number of employees. So today's workplaces have definitely changed. And then you add the end result of all the other things, which is greater mental health challenges and fewer mental health resources. Our counselors are all booked. Some counselors are booked for months on end. We're seeing more PTSD cases from pandemic trauma, just like after 9/11 and hurricanes and disasters. I know it feels like we're trying to do the best we can at emptying that ocean of pain with our buckets. But that's life in today's post-pandemic world. So those are the 6 factors that are creating what I think of as emotional erosion. So given that, it's time to pull some resources together. Now that you have awareness, then you can start focusing on 4 ideas to make things better. And I encourage you to look for just one of these tips. I'm going to zoom through these tips, and I hope you find one that works. The first stabilization technique is to check your attitude. I've been teaching about bounded optimism since the beginning of the pandemic, and it's just as relevant these days. James Stockdale, U.S. Navy Vice Admiral Stockdale, was the highest ranking prisoner of war in the Vietnam War. His job, as he saw it, was to keep his fellow prisoners going through challenging days, weeks, and years as a POW. He provided them with not fake optimism, we'll be home by Christmas, because he found that didn't help, it only made things worse. He later said it was the optimists that didn't make it home. Instead, he encouraged people to stay resolved and stay strong for however long it took. He provided inspiration, hope, and a bounded optimism tempered by reality, and his fellow POWs credited him with helping them stay sane and strong and together through years of captivity. Find that middle ground, halfway between Pollyanna, happy, 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 and Debbie Downer, or maybe Olaf and Eeyore. Forced, cheery, fake optimism doesn't help people, and neither does chronic pessimism. The challenge is to stay in the middle and continue to balance a bounded, realistic optimism that will get through this. If you find yourself going in either direction too far, you're probably off base and could use some help getting back to that middle balancing point. Watch your use of negative feedback. There's a trusted old management rule that supervisors need to give 4 positive feedbacks for every 1 negative feedback. So the more you can make an effort to continue working on catching somebody doing a great job or being positive or making a difference and saying, wow, great job, or thanks 4 times as much as you correct them. Next tool is to work on your resiliency. That's the ability to overcome life's challenges and bounce ahead, not back, stronger, wiser, more powerful. Stuff happens to all of us, and how we grow through these challenges at what makes us resilient instead of broken. Here's some tips from the Center for Creative Workshops on 8 things you can do to build resistance, from building a network of support, socializing, getting regular exercise, make sure you sleep, take time for mindfulness, embrace new perspectives. My favorite, savor positivity intentionally. When something amazing happens, roll around in it, hang on to it. If you happen to get into a good mood or a positive experience, savor that as much as you can. And the last one, practice gratitude. Take time to thank other people. Third method of fighting off emotional erosion is to practice good self-care. That's more important than ever these days. This involves something that may be hard for a lot of us, making time for yourself. It's just as important as any medication you take daily to survive. Self-care isn't a recreational luxury. It's more important than ever to deal with today's challenges. And it's important to continue to consider the big picture of your life and to make sure you're balancing physical, emotional, mental, and spiritual self-care. And what we're calling extreme self-care, which means you don't have to quit your job to practice extreme self-care. You just start doing 1% more. You don't jump into a marathon if you're not a runner, but you can do 1% more than you're doing now, and that'll help you get there. So here's some tips. What's 1% more you could do physically, emotionally, mentally, or spiritually? There's some tips on this slide. Here are 9 different self-care tips for compassion, fatigue, and taking care of yourself. Again, get enough sleep, eat a healthy diet, exercise often. Those are things we've seen before. Drink plenty of water, take time for self-care, practice meditation, take time off work, ensure you have an identity outside work, and have someone you can talk to. What can you do to keep your brain in tip-top shape? I'm going to share 13 medically reviewed brain exercises that can help. And again, you don't have to quit your job to do these. They don't have to take up a lot of your day to help you keep that brain functioning well. These are evidence-based activities that offer the best brain boosting benefits. And again, if you can find one in here to do this next week, every day, once for a minute, that'll make you better. Jigsaw puzzles, play a game of cards, build your vocabulary, dance, use all your senses, learn a new skill, teach someone a new skill. Music, music, music. Try a new route, meditate, learn a new language, do Tai Chi. And the last one, focus. Anytime you're focusing, you're doing brain crunches that can help your mental fitness. So that brings us back to the emotional erosion model. I covered what leads us to emotional erosion, 4 things we can do to reduce this. And now it's up to you to take action. Whatever action you take should slow down or reduce erosion, stabilizing you for continued challenges ahead. If whatever action you do isn't increasing your stabilization, you bring in more resources. You talk to your chief, your HR, your EAP, your family and friends and colleagues and coworkers and mentors, and you use whatever resources you need to keep moving forward. If you work for an organization that has an EAP, your EAP is available to you. If you need counseling or anti-erosion coaching, give your EAP a call. You can access free and totally confidential counseling. Nobody at your company knows you use the EAP's services or anything you discussed. Most EAPs also have legal consultation, financial consultation, mediation, elder care, ID theft, and the like. And again, all of these services are free and totally confidential. And if you work for an organization that doesn't have an EAP, this is a commercial, give me a call. But most larger organizations have some kind of EAP, and it's important to know that so you can remind your coworkers that they have some help available to them. So I'm going to close with a hearty mahalo for all of you for hanging in there, for helping so many people during this challenging pandemic, and for putting up with all you put up with. I'm going to now stop sharing my screen, and I would welcome any comments you might have. And thank you.
Thank you. Any questions for David? Great information. Can you tell us again what major companies you folks offer services with?
Sure. In the healthcare field, we cover all the Queen's employees on every island. We cover Maui Health's physicians. We cover HPMG physicians and nurse practitioners and PAs, diagnostic labs, Hawaii residency. We have an employee assistance program and a physician assistance program as well, a PAP, that some organizations just use the EAP for everybody. Some organizations just have a PAP for their physicians, and some organizations have both. I think those are the basic ones, but again, if your family member, if your spouse works at Zippy's or Foodland, they have EAP. You can use the 250 other companies. So even if you don't work for a company that has an EAP, there's a good chance if your spouse or partner is working, you may be able to use their EAP benefit as well.
Interesting. Thank you. There were a couple comments, not quite questions. Ella said she's stressed out with COVID, just trying to get things back together again, and she's retired, so she can use it. And I think when you're talking about the self-care or positivity, thinking positive, Dr. Cohn said that he has been practicing that this whole meeting. Thank you, Dr. Cohn.
Wonderful.
Any other questions? Donna says, thank you, great presentation and great information. Karen says, being on the side of positivity, can you share a real life example of a workplace program that has worked?
Oh, yeah.
Great question.
On the size of positivity. Yeah, we just gave a training to a large organization who had felt the concerns in their company due to suicide. They'd had 2 people die recently from suicide, and we're seeing a lot more of that all across the state. So they brought us in to do here's how you deal with suicide training. and they got 2 people in for care that they probably wouldn't have otherwise, because they trained their staff and their managers how to do the right thing, the Pono thing, the appropriate thing, how not to overreact, how not to underreact, how to use internal resources in HR, how to use external resources in your EAP, or by calling 988, or by going to the hospital ER, how to get some people some help. So that's the most recent one I can think of. School children, that's the other common question. Excuse me. It's just been hell for a lot of kids. You know, I saw the YouTube video a year ago about a 3-year-old meeting another 3-year-old for the same time, or for the first time, because he'd never seen another child, because he'd been sheltering in place for the past couple of years. And, you know, just the joy of meeting another child or hanging out with another child was just, you know, just blew me away. And, you know, children who are homeschooled are having a challenging time with that. Children who are returning to school, college students, you know, we've had a lot of concerns from employees about their college students on the mainland because of COVID. You know, they got off the island, went to the mainland, and COVID hit, and they were trapped somewhere for a couple of years, not being able to come home, or not being able to do the usual things that college students do to learn about life. So it's been hard on kids to college age kids as well. We've seen some decreases in learning because of COVID, with special, you know, if you've got a kid with ADHD or got a kid with some diagnosis, it can be even harder for them to manage the COVID issues. You know, trying to be at home, going to school for a year or two, while your parent is at home trying to work for 40 hours through telehealth, has been challenging for a lot of families. It's brought up, again, more child abuse, more domestic violence, and there wasn't any escape from that for a while.
Yeah, Ella says that kids definitely seem to learn better when they are interacting socially.
Yeah.
We have another comment that came in that said they really appreciate this talk and this discussion, and how you address burnout and all of these stages, and they don't feel that this is addressed enough. For example, we have discussions about stages of grief, but not so much that there are stages of stress and burnout. So the stages in itself are important to bring awareness to. So thank you. We have another question back to the students. How do you feel about middle schoolers still wearing their mask in class where other teens have let go of wearing them?
Again, riding the bus to work this morning, which I don't often do, but today I got to take the bus. I was the only one on the bus with a mask, and you know, I'm supposedly a little more sophisticated than most middle school students. I can't imagine how hard this must be for middle school people to deal with peer pressure and feeling like they're the weird ones because they have a mask on, and or having to explain that. And yet, if you've got a parent at home with a medical condition or something, that's the safe thing to do. That's the right thing to do. And having to explain that, do you want to explain to your kids, well, mom has an autoimmune disorder, so I have to wear a mask because I like to keep my mom alive, or whatever the case may be. Grandpa's going through chemo, so I don't want to expose my grandpa to COVID or the flu or the cold or anything else. It's hard for kids at any age, especially in middle school, to have those kind of conversations and feel like they're not the ones who's being weird or wrong or something.
Yeah, definitely. We have a question about EAP services. Where did it go? Those trying to keep jobs. Does EAP assist in an employee appeal for their wrongful termination?
EAP has to stay out of those issues, because we're funded by the employer. And if we got involved in that situation, and even if we were 100% ethical and neutral, if we sided with the company, all the employee would have to say is, well, of course you sided with the company because they paid you. And we lose the appearance of being neutral. Or if we side with the employee over the company's going to fire us because we sided with their employees. So either way, we're kind of screwed there. So we stay away from, and because EAP is so confidential, we don't keep a lot of notes. We don't document people's problems. We don't even diagnose people. To see a counselor through your insurance company, they have to diagnose you as you walk in the door to get paid. So to see a counselor under your healthcare insurance, you have to accept a diagnosis of a mental disorder. To see an EAP counselor, we don't diagnose you. We don't care. So we don't document their problems. We don't diagnose them with a mental health disorder to treat them. And we can't help with certain work-related challenges because we're paid by the employer. But good question.
Makes sense. Another question: what cultural differences, if you are aware of any or have come across any, are there in relation to coping abilities?
Oh, good question. In some ways, we're very lucky to live Hawaii because we have more local connections than a lot of people have on the mainland. A lot of people here have their auntie or their cousin or their sisters or their brothers or their nephews, whatever, in the same community. So they have more internal support systems, but those people sometimes also drive you crazy. So maybe that's also a stressor as well. I don't see any, Asian Americans, African Americans, Hispanic Americans have had greater mental health challenges due to COVID, statistically. So there are some differences. I haven't seen that in the work I do. I haven't seen that people of different cultures are using the resources any different. It's different than it used to be a decade ago. A decade ago, I would have said, people from an Asian culture don't seek help as much because that's not what their culture does. And even that's changed. That's not as much an issue as it used to be a decade or certainly 2 decades ago. So I'm not seeing, and we look for that. We look at statistics and everything else. I'm not seeing a change in how people utilize the services based on their culture, which is good news.
Ella, are you referring to the coping? She says that there are still hard-headed ones that don't want to seem weak, and I think she's
oh, absolutely. I don't know. That might be, if I do see, we see differences on every island. The people on the Big Island seem to have more challenges of one nature than the people on Kauai. Versus Oahu, versus Maui, versus Molokai. So there are hard heads, though, in every culture, on every island. And I see a difference, comparing government workers on Oahu versus government workers on the Big Island, for example. I see more people on the Big Island who say, that's just the way we've always done it. I've always been able to swear at my employees for the past 40 years. And, what do you mean I'm getting written up for swearing at my employee? When somebody on Oahu probably learned that 10 years ago. So it's a little slower in terms of how people are catching up to today's way of doing business and what's acceptable and what's not acceptable in the workplace. But there are certainly hard heads we've seen in every single island.
Yeah, for sure, in every sector as well. We have time, so I just want to make sure I get all the comments. Back to the mask thing. Ella says she still wears a mask in Costco, and Dr. Cohn has offered up a joke, some humor. He says, "Where are we going, and why am I in this handbasket?" Thanks, Dr. Cohn, always bringing the laughs. Um, Aurora shared a nice comment back to the socializing, the children socializing. She said that recently her daughter befriended a very sweet autistic girl next door, and it has positively transformed everyone on every end. Thank you for sharing that.
Nice.
Renata asked, oh, sorry, go ahead. Oh, Renata asked, how much can a system change to even out as many issues that can be modified, and how fast? Do you have any comments to that question?
I think that primarily decides on the size of the system. If you're a one-person operation, you can shift on the dime. If you're a if you're Queens or Kaiser, it's harder to turn that cruise ship around in the middle of the bay and make a change. So and it depends on what their pain points are. Every organization that I work with has different pain points, and they're all trying to adapt to the reality of COVID as fast as they can and as well as they can. And the amount of changes they have had to make over the past couple of years have just been insane. I did a presentation for HR professionals at SHRM, and 60% of physicians are burning out. 98% of HR professionals are burning out across the US, because one of the reasons is they had to be the experts on COVID in their organization. They had to change policies every single day, every single week to deal with the reality of mask making versus not, or mask wearing versus not, versus immunization versus not, versus remote workers versus not. Healthcare workers have certainly been slammed, but the amount of changes that just about every company I work with have had to make over the past couple of years has just been crazy. And people are still recovering from that. And they've done remarkably well at making the changes. And many of them are really, most of them are really aware of the mental health challenges that their people are facing. They're considering that. They're doing trainings on how to help your employees with mental health issues. So they've been fairly, a lot of them have been amazingly proactive in terms of how they have helped their people deal with the mental health issues. Some of them not so much. Some of them it hasn't hit them like other organizations. But we've dealt with some companies that have just been amazing in terms of what they have done and what they've changed to help their people deal with the reality of COVID.
Can you speak to Beth's comment that it is super unfortunate that when we speak of this burnout and the solutions that are offered up, it's often individual focused and not on the deficient system and the environment that the burnout is occurring from?
Yeah. Well, in my presentation to HR professionals, I talked about companies have to change. Companies have to figure out how to pay people more. Companies have to figure out how to get more flexible in their scheduling, or when people want to work from home versus not. Companies have to figure out how to listen, how to take care of their employees. So there are, in scheduling and workloads and everything else, the workload in the healthcare profession has just been insane over the past couple of years. Again, when every company is saying we used to have 10 people and now we've got 8, and we can't hire 2 more people, or every company is struggling trying to fill those open spots.
Yeah.
And the companies certainly struggle with that. And Maybe if a company, and my advocacy is, if a company's only paying 8 people to do 10 people's job, maybe they should take those 2 extra salary and divide it among those 8 people. So they can get, so they can take care of people along the way that are doing the work of more people. But yeah, most people don't see it that way. Most organizations don't see it that way because they're trying to find people to take those positions.
For sure. Do you do any work in the airline industry? Curious question.
We have indeed.
They suffer a lot of burnout too.
Yeah, absolutely. Absolutely. With flight attendants getting stabbed and
Oh
yeah. So yeah.
Okay, any other questions for Dave? Thank you so much. This is a really good discussion. I like how you break it down as well into the different stages. And so if, say, an employee works for a company that you folks do not already partner with, what can they do?
Well, they can call us and we'll certainly see if what we can suggest to them. They can call 211, see what United Way suggests the resources are. They probably have healthcare insurance, so they can ask their healthcare provider or go onto the healthcare provider's website and see what clinicians are available near them. There are tons of resources available on every island to help people in need.
Great, thank you. Lots of thank yous and mahalos coming through the chat. So be sure you look through there, and thank you, everyone. Let me see real quick. What do we have next week? Oh. Next week we have Dr. Need coming to talk about integrated primary care. He's a really great presenter, and you folks surely don't want to miss that. So again, check out all the thank yous. Dave, so awesome. Thank you for being here. Mahalo, everyone. See you guys next week.
Take care.
Thank you.
Stay safe.